It's not dirt, it's chemistry. The reason your pores look clogged isn't because you're unclean. It's a complex reaction happening right under the surface. A mix of your skin's natural oils, or sebum, dead skin cells that didn't shed properly, and environmental debris. When this mixture gets exposed to air, it oxidizes and turns dark, creating what we see as a blackhead. It's a stubborn plug that simple washing just can't dissolve. Still breaking out after a deep clean? The secret isn't scrubbing harder. That often makes it worse by irritating your skin. The real solution is in the sequence and dosage of your products. Today I'm running my Global Trend Cleanse that creators worldwide are using to flatten pimples and clear blackheads, fast. This isn't just a routine, it's a strategic system. Global stands for gentle, layered, oil-dissolving, barrier-aware, acid-mapped, and logical. It's a multi-step approach designed to work with your skin's biology. We'll prep, cleanse, exfoliate, mask, extract, soothe, treat, and seal. Let's begin. First, prep. We need to soften the hardened plugs in your pores. Take a clean face cloth, soak it in warm water, not hot, and press it gently onto your nose, chin, and jaw for 2 to 4 minutes. This warmth helps loosen the oxidized sebum, making it easier to remove. For an optional boost, use brewed green tea instead of water for its soothing antioxidants. Or add 1 single drop of tea tree oil to the water for its antibacterial properties, great for active breakouts. If you wore heavy SPF or makeup, do a quick swipe with micellar water first so our oil cleanser can get straight to work. Now, the cleanse phase, starting with an oil cleanse for a full 60 seconds. Apply it to dry skin. This is crucial. Oil attracts oil, so it will latch onto sebum and sunscreen. Gently work it into the creases of your nose and chin. Then, wet your hands and massage again. You'll see it emulsify into a milky texture. This means it's ready to be rinsed clean, taking all that dissolved gunk with it. Next, the water cleanse, also for 60 seconds. This second step removes any remaining oily residue. Use a cleanser with salicylic acid to get inside the pores, or a gentler option with heart leaf or green tea to calm the skin. This ensures you're thoroughly clean without stripping your skin's protective barrier. If your skin feels tight or squeaky after, your cleanser is too harsh and stressing your barrier. Time to exfoliate with precision. For blackhead-prone zones like the nose and chin, use a BHA or salicylic acid at 0.5% to 1%. Apply it with a cotton pad 2 to 4 times per week, only at night. Press it onto the skin. Don't rub. BHA is oil-soluble, so it travels deep into the pore lining to dissolve plugs from within. For more sensitive areas like your cheeks, opt for a gentler acid like PHAs, LHAs, or low-concentration lactic acid 1 to 3 times per week. This is acid mapping, giving each part of your face what it needs. A critical rule: always skip exfoliating acids on nights you use a retinoid. And please, throw away gritty physical scrubs. They create micro-tears in your skin, which invites more bacteria and congestion. For an extra boost, once or twice a week, try an enzyme mini cleanse. Add a tiny pinch of a papaya or pineapple enzyme powder to your gentle cleanser and massage it on for about 45 seconds. These enzymes digest the cap of dead cells on a clogged pore, clearing the way for other ingredients. Now for the mask, our clay magnet. Once a week for 8 to 10 minutes, apply a clay mask. Mix kaolin or bentonite clay with water or brewed green tea. Apply a thin layer and rinse it off when it's about 80% dry, just before it feels tight and cracks. Waiting too long can dehydrate your skin. This step acts like a vacuum, pulling loosened impurities to the surface. If you have combination skin, just apply it to your T-zone. Next, a very careful extraction. Only attempt this after steaming and masking, when pores are prepped. Sanitize your tool with alcohol or wrap your fingers with tissue. Hygiene is non-negotiable. Position the tool or your fingers beside the pore, not on top. Apply gentle pressure with a slow, rocking motion to ease the plug out. Follow the rule of 2s. If the clog doesn't lift in 2 light tries, stop. Forcing it causes trauma, inflammation, and dark marks. And never, ever try to extract deep, painful cysts that have no visible head. Treat them with a patch or spot treatment only. Immediate post-care is key. Apply a localized dab of salicylic acid to the area to keep it clean. Then use an ice roller or a cold compress for 30 to 45 seconds to calm inflammation and reduce redness instantly. Now soothe. Your skin has been through a lot. Drench it in calming ingredients. Use a hydrating mist, toner, or essence with ingredients like Centella asiatica, heartleaf, or panthenol to cool redness and begin barrier repair. Time to treat smart. Pick one targeted serum based on your main concern. If you're oily and congested, choose a niacinamide serum at 4 to 5% to balance oil and refine pores. If you're dealing with red marks from old breakouts, a thin layer of azelaic acid is your best friend. For an active whitehead, spot treat only with 2.5% benzoyl peroxide or a sulfur-based alternative. Finally, seal it all in. Use a lightweight gel moisturizer, preferably with hyaluronic acid and ceramides. This hydrates and repairs the moisture barrier, preventing rebound oil production. And for your morning shield, a non-comedogenic SPF 30 or higher is mandatory. UV exposure darkens acne marks and slows healing. To make this work long-term, you need a smart weekly schedule. Night A, use your BHA on mapped zones, then soothe and moisturize. Night B, this is your retinoid night. Use a pea-sized amount, then soothe and moisturize. This normalizes skin cell turnover. Night C, this is your recovery night. No strong actives, just focus on barrier support. This rotation prevents overexfoliation. For sensitive skin, start with just one gentle active night, like PHA or lactic acid, followed by several recovery nights to build tolerance. What can you expect? Within 24 to 48 hours, redness will be down and active whiteheads will look flatter. After 7 to 10 days, your nose and chin will feel significantly smoother. And by the 4-week mark, you'll see a visible reduction in the blackhead cycle. This is about consistency, not a one-time fix. Now for a final safety check. The biggest mistake is doing too much too soon. Never stack strong actives like BHA, a retinoid, and benzoyl peroxide in the same routine. This is a recipe for a damaged barrier. And listen to your skin. A slight tingle with a new acid can be normal, but if it burns for more than 30 seconds, rinse it off immediately with cool water. Just apply a calming serum and moisturizer. Skincare should never be painful. Drop A if you're starting the global cleanse tonight. I'm excited for you. Comment below with your skin type and your toughest zone, whether it's your nose, chin, or jaw, and I'll pin a custom mini-map to help you get started. This method is about being smart and consistent, and you will see results. Like, share, and subscribe for more barrier-safe deep cleansing that actually works.